Look, I'm sorry that was slightly over the clock from where we were initially, but you're going to talk about transformation in research delivery at Guy's at St Thomas's. You and I have had a little briefing about a week ago, I think, just to kind of put this into perspective. Those of you that don't know, who missed the introduction at the moment, first of all, I'm not Charlotte Toulouche. I'm borrowing Charlotte's laptop because it's properly linked here in the River Suite at Guy's at St Thomas's, or actually in St Thomas's here. My name is John Wilkes. I'm the Chief Exec of the Institute of Health and Social Care Management. And this, ladies and gentlemen, is Clair Harris, and Claire is the Head of Research Workforce at Guy's and St Thomas's. And Claire's going to talk about transformation in research delivery at Guy's and St Thomas's. And I think, Claire, you've got a presentation that you'd like to share. I think I'm right in saying that. There we are. You see, by the power invested in me. So, Claire, I'm going to hand straight on to you. Thank you very much indeed.
Thank you. Yes, so thank you for asking me to come and talk. I'm Clair Harris, Head of Research Workforce at Guy's and St Thomas's Foundation Trust. So I lead the research delivery teams who are embedded throughout our clinical services at the Trust. But I also have a role with the South London Clinical Research Network as the lead research MMAP there as well. I'll go to my next slide. So I'm just going to share our approach and our experiences of how we transformed research delivery service in the pandemic. But how, as a result, we've now managed to embed a new service that really sort of broadens our R&D infrastructure and has developed our competencies. So we're well positioned now to respond to some of the new priorities that are coming through nationally, and also improve access to research for our communities. So I've sort of tried to summarise that in this slide. And actually, I'm really focusing on how our service, how we sort of transformed the structure of our services. But actually, it was so interesting to hear the previous talk. One of the big things that changed during the pandemic was actually how you deliver research. And we had lots of conversations about reaching people in their homes. So that was really interesting. So research is organised in our trust as like a network of research teams that are embedded throughout all the different directorates and specialist services that we have, and they will be delivering on locally led or nationally led projects, which include early to late phase drug trials, device trials, observational studies. And those teams are supported by an overarching R&D infrastructure that has functions like our governance team, who look after approvals, sponsorship reviews, contracting, and we also have some clinical research facilities, which are staffed clinical spaces that researchers from throughout the trust can use to deliver on their early phase research. So I would just begin my talk by just outlining what clinical research delivery is and the sort of roles and competencies that we typically have in our research teams. But then I'll go on to talk about how over the course of those first months in the pandemic, we completely transformed the structure, bringing all of that network of teams and functions together, in fact, into one big team that was focused on the urgent public health research and the clinical front line. And then finally, I'll come on just to talk about the decision and the approach we took towards the latter part of 2020, where we decided to formally establish a COVID and a vaccine research delivery team, and how that has now become part of our R&D infrastructure, which has given us sort of the resilience to respond to all the new priorities and challenges in research and really improving access for our communities to research. So what is research delivery to begin with? So this slide shows the whole research process, which begins with formulating research questions, developing research protocol, getting all the necessary external approvals such as MHRA approval, Health Research Authority. And then it progresses on to local feasibility assessment at NHS providers and approval locally to do the study. And then once approved, the participant recruitment stage begins, and that's where the clinicians will be identifying participants who are eligible, offering them the opportunity to take part, working through informed consent, supporting them, delivering the interventions such as the drugs, and collecting data for around those individual cases. And then, of course, the final stages in the research process are the data analysis, and then the publication and sharing and dissemination of results. So when we refer to research delivery, we're focusing on these 3 stages here that I've circled and that are conducted at our trust. And these figures that I've shown at the bottom, they've been drawn from our commercial trial performance data from 2018 and 2019, and that just shows the sort of typical scale and pace of studies pre-pandemic. So these will be the type of studies that are sponsored by pharmaceutical companies, and typically the local approval stage would be taking around a month, and we'd be recruiting around 8 patients over the course of 18 months. So just moving on to the sort of, these are some of the examples of some of the roles that we would have in a research team. So this actually depends on the size and the type of portfolio that the different specialist areas are looking after, because so individuals may actually take more than one role in a team. But so you can see there's the principal investigators, who are the clinicians who lead on the proper conduct and the oversight of the study, the research governance and quality staff who make sure that the regulatory requirements and the protocol is adhered to, research nurses and clinical practitioners who typically do the patient participant clinical assessments, consent stages of the study, pharmacists who've got the expertise to look after the investigational medicinal products, the lab technicians, and the data managers who look after submitting complete and timely data set, which is really the key requirement for the sponsors of research studies. So as well as the clinical skills relating to the professional scope of practice and the context that they're working in, members of the research team will also have the clinical research expertise around applied research methods, regulatory knowledge, and that sort of thing. I'll just skim over this. This is just some data that came from a staff survey we did that just demonstrates the sort of thing that motivates people to work in the research teams and why they choose to work in research. So hopefully I've set the scene on how our teams are organised and the sort of work they do. So it's a network of separate teams with different sort of sizes and portfolio types, but they're embedded within our clinical services and they're supported by a strong R&D infrastructure. But of course, in 2020, all of this changed, and very quickly and very drastically. And so this timeline here just shows those first few months of the pandemic, and we've marked some of the milestones that relate to what was happening in relation to research naturally. So in the March, when the trust was starting to see patients coming through for more testing and more patients getting admitted, most of our embedded research teams were winding down, stopping their research, and actually quite soon after that, the Department of Health and Social Care and the National Institute of Health Research mandated that all non-COVID research should be paused. And they introduced a process for designating urgent public health studies. So over this time, all but absolutely essential research, non-COVID research activity was paused, and our research staff, we were redeploying them to support the front line, the ICU and the COVID wards. Now, just one point I was going to emphasize, that before the pandemic, the clinical research team that we had in infection was actually one nurse. So in these early days, we also were gradually allocating more and more staff to support as the portfolio of COVID research started to come through and the activity was increasing. In R&D at this time, we created a prioritization group, and that was just to make sure that we were prioritizing the urgent public health research effectively according to how we were mandated nationally, and to make sure that we were providing our patients with the best access to the emerging treatments, experimental treatments. So we quite quickly decided at this stage to formally redeploy a dedicated research team to work on COVID across 7 days, to make sure we were offering the opportunity to as many patients as possible access to these experimental treatments. And then sort of coming on to sort of end of April and May, I remember really clearly the clinical pressures were starting to settle, and we were starting to talk to the trust about repatriating staff who'd been redeployed. And that's when we were approached to take part in the phase 2 and 3 Oxford vaccine trial. And I really remember feeling so positive at that point and excited, thinking it's so great to be part of research that's going to bring a way out of this pandemic, but was quite unaware of just how challenging and demanding those weeks would then be after that. So to put it in context, if you remember on my first slide when I was talking about the sort of scale and pace of studies, typically this study we were asked to set up within a couple of weeks, and we were to recruit more than 500 patients within a month. So we really quickly mobilized really the whole of the research infrastructure. So it was just really amazing. All the expertise and knowledge, leadership just all came together, organized really quickly to deliver on this trial. And just as we were coming to the end of that first recruitment period, then the NIHR launched the Restart programme, and so they were asking trusts to start reopening non-COVID research and issued prioritisation guidance on how we should prioritise the COVID research but make sure the non-COVID portfolio was restarted again. So we really wanted to support the managers in our network teams to be able to plan their restart. So we decided then we should just formally second a team. So everything was really clear of who was working where, invited the staff who wanted to remain to deliver on completing the follow-ups for the vaccine trial and the COVID trials that we were working on. Now, through this time, the vaccine task board had been set up in the April, and all the indications up to this time had been that they were intending on having some centrally coordinated team to mobilise on delivery of ongoing vaccine trials. But it was actually coming around to the September when we learned that the delivery of ongoing COVID vaccine trials would actually be devolved to the regions, and we got asked then to deliver another vaccine trial there in collaboration with our colleagues at KCH. So now I'm going to move on to talk about some of the considerations and the decisions that impacted on how we then approached the next stage. So the key consideration for us was that we wanted to continue to make a really active and timely contribution to supporting COVID research, the management of the pandemic, and really maximise access for our community. We knew we had really strong strategic support, so there was funding from the research networks relating to the vaccine task force. There was a nationally coordinated approach for identifying sites and participants to take part in studies. But we, of course, wanted to really minimise the impact on and the access to the non-COVID research that we already knew had been really severely negatively impacted. This is access to sort of experimental cancer treatments and things for long-term conditions. So we knew we wanted to extend and formalise our team so we could respond to the requirements of the vaccine trial, but still continue, but without impacting on the rest of our portfolio. But we knew at this time that the pool of staff would be probably limited, and there would be a really steep learning curve as well. Space was very limited. We knew that we would have really high volume activity and the time pressure, but actually one of the key challenges was that obviously a primary outcome measure in the vaccine trials is, and the most crucial part of the data collection was assessing symptomatic participants to come to site to establish if they did have COVID. So we needed a safe space as well to bring the symptomatic patients. And we also knew we had a really diverse and large local community, and we wanted to make sure that they all had access to these early vaccines if they wanted to. But we did also know that there was some apprehension in the community as well relating to vaccines and also research. So this just sort of summarise a little bit of some of the decisions we made. So the photos show the portable clinical space that we leased. which we called our mobile clinical research facility. And so these were really lovely clinical spaces where we could safely bring symptomatic patients, and it obviously gave us more space and capacity as well. And here was just some of the roles that we considered important. We knew that leadership would be really important because it was a newly formed team that would need to be very organised very quickly. So we put in the leadership roles. And we put in an education and training role as well, because we knew we'd have to be inducting a large number of people and supporting training of staff who were probably new to research as well. Dedicated business support was actually really crucial, because the logistical effort of managing the number of supplies, the appointments and all the sort of systems we were using to manage that was a really big piece of work. So we needed staff to coordinate all of that. And also a small laboratory team. There was lots of sampling required, very complex protocols. So we put in a laboratory manager as well, and a quality manager, because obviously the key thing was maintaining the high quality standards, the good research practice, the regulatory adherence, and we knew that there'd have to be a real focus there with such a large and new team. So this team were all supported by the clinical and non-clinical research staff that I described earlier, and also the support of our existing R&D infrastructure, and particularly comms, who did a lot of work reaching out to the community, making sure using social media and local press and community leaders to make sure people were aware of the opportunity to access trial vaccines. So in terms of what has been achieved, this slide just shows that some headlines. So the team have delivered on 30 clinical trials, recruited 3,000 participants, and then you can see there in the top right hand corner, a big proportion of those have been vaccine trials, but we've also done other interventional studies and observational studies looking at the long-term consequences of COVID. The team have exceeded the recruitment target, so you can see also in this top left-hand tile how they've managed to achieve the much greater pace and volume than is typical. So they were setup time was reduced to a sort of around a week. They were recruiting 72 patients on average into each trial, sort of comparing to the average of 8 pre-pandemic. So we've managed to cover the costs over this time. So through working with commercial partners and delivering on commercial research, we've managed to cover the costs of the team, and also added value as well with things like work experience and student nurse placements as well. So in terms of and here this is just we give the opportunity of participants to give feedback via the patient research experience survey, and this is just some of the feedback from patients, which was really lovely. The sort of positive effect they felt of contributing, taking part, helping their community, and also positive comments about the service they receive from staff. So in terms of where we are now and what the current research environment looks like, so despite the outstanding response to the COVID pandemic, which we took part in, there has been recognition in the sort of policy refreshes that have come out from the Department of Health and Social Care and the NIHR of the importance to address the current priorities in health and social care. There's been really major challenges faced by the research delivery system generally. There's because of the backlog, the workload, workforce issues, and there's been a real central focus on restoring and vitalising the whole of the UK research portfolio. Commercial trial activity in the UK has actually fallen well behind what it was previously, and a report has made recommendations to improve performance. So there's a real drive centrally to revitalise research and focus on commercial research. And the government has now made these new strategic partnerships with Moderna and BioNTech with a new vaccine programme. So our team now, this really strengthens the ability in our trust and our infrastructure to respond to these new priorities and the opportunities. So by providing additional capacity and allowing us to respond to these new priorities relating to vaccine programs in the UK. So to finish, I just thought, am I okay for time? Got a minute or so.
Yeah, you've got a minute, Claire. That's fine.
Okay, so this is just reflecting on some of the challenges, and I can add a bit more detail to the slides before you share them. But I think some of the key things that we want to take forward, it relates to diversity and inclusion, really making sure we are giving opportunities to everyone in the community to take part. So that's something we're really focusing on. And the visibility of research through the pandemic was really prominent. It was on the news every day. But it's a lot of the new policy directions really emphasise the importance of embedding research in the NHS, and that's something as an R&D we're really focusing on, the sort of research culture generally within the trust. The pace of transformation was one of the key things in terms of reflection. Everybody was new in the team, all working on very different ways of working. How research was delivered in the pandemic was very different. A lot of people were new to research and also new into promotions. So we've also done some work with the leadership team in really focusing on team building up a sort of a common vision and ways of communicating together. And that's really sort of strengthened the leadership in the team as well. And I can sort of add a little bit more information to share with you afterwards. But I think that early stage where we were just reactively bringing teams in and changing things very quickly, that we learned was the feedback from staff who took part in that and came together, noticed how they learnt new skills from coming together, where we have our teams sort of working quite independently within their different clinical areas. Their portfolios, sometimes there's certain things they don't come across, practices that they're not aware of, and that coming together, people commented that they really learnt a lot. So that's something that else we want to take forward, maintaining that networking, skill sharing, skill development across the research teams.
That's perfect. So, I was going to ask you actually if there's anything that you'd particularly learnt from the experience that you'd now adopted irrespective of COVID research, and you've kind of just answered the question, I guess.
Yeah, that was one of the things, but also I think because I think partly the sort of scale of it sort of made you realise how so we put in place, really, this is, I say we, all the fantastic people, all the expertise of the people across all our teams came together, and really robust processes for, say, communicating. So the COVID studies typically have many more amendments and changes than was typical before. So we were having to really quickly communicate and retrain the team on changes to research protocols and that sort of thing. And so develop some really good systems for effectively communicating that and making sure we were maintaining quality. So there's certain processes there that we've definitely been able to share with other teams and implement further as well.
Thank you. I just wonder if we've got any questions at all. Quickly for Claire, Susan has asked, did you draw from retired researchers with an interest in this at all, Claire?
Well, in those real early days when we were really reacting to just try and deliver, we did a number of things. It was actually, I have to say, one of the frustrations. So we were getting quite a lot of offers of, can retired people come, or medical students, and we explored loads of the things, but actually many of them were a bit cumbersome and time consuming to get everyone the correct sort of rights to work. That we did have some people who were working remotely, so we really adapted how we were working quite quickly. So people who were, say, working from home and stuff like that, but it was actually quite challenging. We had people really wanting to come and help, but it was actually hard to make it happen.
Listen, don't beat yourselves up. That's circumstance, and
yeah,
everybody had to do stuff that, with the benefit of hindsight, they might have done differently and so on.
Yeah.
That was the circumstance at the time. Clearly, you guys did a brilliant job. I mean, the evidence is there. The sadness, of course, is that one only has to walk along the memorial wall here to see the impact that COVID has. And it's thanks to researchers such as yourself and your colleagues that wall isn't longer, I suppose. That's the only thing I would say. So thank you on behalf of everybody on the call today and rest of the nation. It seems a bit pompous for me to say it, but I can't find an easier thing to do, really. You know, it's thanks to you guys that so many of us didn't fall ill with it. And yeah, thank you. All right. Do we have any final questions at all for Claire, I wonder, from anyone? Okay, well, look, that's been brilliant. Claire, thank you so much. I mean, I've learnt so much from that. I didn't realise the scope and scale and complexity of how research goes on, and you've opened my eyes to that. And we'd love to have you come and chat to the team, perhaps in future, to other members, and of course in the future, about maybe how you set up clinical research activity. And I'm particularly looking at our members who are involved in social care, who often don't get involved in research studies and so on, but there is so much that we could do to learn about social care techniques, treatments, care pathways and so on, that would really benefit, I think, from a clinical research approach. And maybe that's something that we can have a chat with you about subsequently.
Yeah, that's definitely one of the priorities in sort of bringing research to areas where previously sort of underserved and not involved, and that is definitely one of the focuses. And it'd be really interesting to talk with Shaheen, because one of the things we really wanted to do during that is reach those people who are being cared for at home, and you know, make sure those patients also have access to research. So really interesting. Thank you.
Good. Okay. Well, look, it's I think the temperature dial is probably about 32 degrees at the moment. I was unwise enough to turn off the air conditioning in this room because it was getting a little chilly an hour and a quarter ago, and I'm beginning to regret that decision right now. But look, thank you so much. We've had some nice comments in the chat about how much people have enjoyed both of those presentations. You know, you are lucky, you guys who are on the call today, to hear from people at the absolute top of their game, like Claire and Shaheen and Edward. So do please, you know, tune in for the next one of these that we do. I can be certain that there's going to be more of them. But in the meantime, Claire, thank you very much. We're in your debt, and you too, Shaheen. Really appreciated it. And travel well, everybody. Have a super week and stay safe, stay strong. And thank you for the brilliant work you're all doing. Bye-bye.